This is the first video in a series of 4 videos on Helicobacter pylori and will be an introduction. What is Helicobacter pylori? Helicobacter pylori is a type of germ or bacteria. This germ enters your body through the mouth and lives in the lining of the stomach. Once in the stomach, this germ survives and lives in the stomach lining for years and decades. It is the most common chronic bacterial infection in mankind, with an estimated 50% of the world's population being infected. The reason why one should be concerned about Helicobacter pylori is that in a significant number of infected patients, it can cause sores or ulcers in the stomach. Also, the risk of stomach cancer is increased in infected patients. It can also be cleared or eradicated from the stomach with effective treatment. Eradication results in a reduction of the possibility to get ulcers and stomach cancer. What is the risk factor for H. pylori transmission? That is, how do people get infected? Studies have been done to show that most people get infected during their childhood. It appears that the following are the risk factors for transmission. Living in close contact with an infected person who has Helicobacter infection. It is believed that the germ can spread from one person to another through contact with saliva or fecal material. The latter happens when people do not wash their hands properly after going to the bathroom. It can also spread through contaminated cooking utensils. Crowded living quarters. Living in a house with many people has close, consistent contact with infected persons increases the chances of spread. Living in a country with poor hygiene or sanitation or unsafe drinking water. The drinking water may be contaminated with Helicobacter. Travelers to such countries may also be at risk. It can also be spread by ingesting food or water contaminated with Helicobacter pylori and can be prevented through hygienic cooking process. How do people know whether they have been infected with Helicobacter pylori? A person might be tested for Helicobacter pylori in the following situations. If someone has symptoms of stomach pain or discomfort, as Helicobacter can cause a variety of stomach problems that present with these symptoms. However, most patients who are infected with the germ do not have symptoms. During endoscopy of the stomach. Endoscopy is a procedure where the doctor passes a thin flexible tube through the mouth into the stomach. The endoscopy is done if the doctor suspects that the patient has HP. In fact, most doctors routinely check for HP when they do endoscopy. The endoscopy might be done for other indications. Endoscopy of the stomach is called gastroscopy. During a routine medical examination, the doctor might add a blood test to look for antibodies for Helicobacter. A positive antibody test suggests that the infection is present. Doctor might want to check for Helicobacter before starting a patient on certain medications, which can damage the lining of the stomach. Some of these medications include painkillers for joint and muscle pain and drugs that thin the blood, for example aspirin. These medicines can damage the lining of the stomach resulting in a break in the lining. These are called erosions or ulcers. Such damage is increased in the presence of Helicobacter. If the doctor finds that the patient has Helicobacter, he might want to give a course of antibiotics to clear the germ before starting these painkillers. Another option is for the doctor to concomitantly give medicines to protect the stomach lining from damage while the patients are on painkillers. Any patient with a history of stomach or duodenal ulcers is tested for Helicobacter. Patients who have a family history of gastric cancer, as the incidence of gastric cancers can run in families, especially in the presence of Helicobacter. The doctor may check whether the spouse of a patient with Helicobacter also has the infection. Otherwise, after the patient has been treated, the spouse, if infected, might reinfect the primary patient. Currently, routine testing for Helicobacter is not recommended.